Hello everyone, I am Dr. Amita Jain. I am Dean and Professor Head Department of Microbiology at King George's Medical University, Lucknow. So I am here attending a conference. All the pathology labs during COVID time has a basic challenge of starting COVID testing. And what were those challenges? Number one, they had no experience of doing any molecular testing. And the tests which were available for COVID testing were basically molecular testing. There was no antigen antibody based tests available. Number two, nobody was allowed to test and they have some kind of quality control or accreditation. So that was another challenge which laboratories felt because they had no idea of quality control also. Whatever happened during COVID time has helped laboratorians in these two methods. They have really learned how to produce good quality testing and the results which can be trusted by the clinicians and patient at the same time. So that was one big advantage. Taking a lead from there, most of the laboratories, they have gone for accreditation. That was a sea change which was seen in practice of laboratories. Number two, most of the laboratories learned that molecular testing was no rocket science. It was doable. Reagents are available more and at a better cost. I remember at a time during COVID testing, there was no availability of test even at a cost of 2,500 rupees per test. And believe me, we have purchased the reagents for around 50 rupees per test. So that was the change we have seen during 6 months period. So COVID has taught us that molecular biology is possible and can be applied easily in every laboratory with some changes, and accreditations and quality controls are very important. Rapid diagnosis is basically used by the practicing surgeons. I'm especially talking about the microbiology practice. Is for 3 tests. They really want to know immediately before they put a knife on patient. Number one, is it HIV positive? Is this patient HBV positive? Is this patient HCV positive? Fortunately for all these situations, rapid diagnostic tests are available. How much to depend on that? Sorry to say, but all of them are not good quality tests. There are certain limitations, but at the same times they can really guide us. My question here is that why a rapid testing before surgery in microbiology is required at all? I think the guidelines suggest that positive or negative, every patient has to be operated. You cannot deny doing surgery on a patient who is positive or negative. So at this point, you can use the rapid diagnostic test, or you may not do the rapid diagnostic test, but whenever you put a knife on a patient, make sure that you are using universal precautions. This is for your own good and for everybody's good. However, it doesn't hurt to do certain tests. Reason being, if it is positive, maybe false positive, you will be forced to take more precautions which are going to be helpful. Any test result which comes has to be doubly checked later, maybe after the surgery. This is what I'm talking about is emergency surgical procedures. But for other procedures, I think you should take your time to ensure that patient is positive or negative and then take the decision forward. Whosoever tests negative should be treated as positive. Reason being, it's not easy to let patient go, and in case it is later on, it's in the incubation period where the analyte we are going to detect is not in the detectable limit, but still the patient is a threat. So even a negative should be treated as if it is positive. Positive should be treated as if it is positive. So you do it or not do it, it's not going to change your practices. Thank you very much.